Okay, this one has extra pressure on me. I'll explain why in just a minute. This is, hey, Dr. Mike, I always watch your videos, even got my pain management doctor watching you. I cut my hand with a grinder 2 years ago. I've had 3 surgeries to repair tendons, had tendons took from other places and transplanted in my hand. He's a really great doc. He cares and he listens. He has me on Oxycodone hydrochloride 5 milligrams 4 times a day, along with Celebrex 200 milligrams 1 time a day. It works, but I'm very active and find days where I feel like I need 5 to 6, and then days where I feel like 3 is all I need. So what do you suggest? Maybe adding an extended release or going up to 6 times a day with the Oxycodone. I also have a double tear rotator cuff that I just can't have surgery on right now because of the recovery time in my work. Okay. This one is, if I was in your shoes, I would probably I would probably ask to go to Oxycodone 10 milligrams, 1/2 to 1 4 times a day, so that you could take either a half or a full dose, okay? And take advantage of the times when you don't need as much, okay? Now I gotta tell you, I'm gonna go ahead and tell you, you're gonna have to have a really good pill cutter, okay? Oxycodone IR has, you know how small it is, okay? But I don't think that he needs to, I don't think that that a plan where, he says take between 4 and 6 is a good plan. I really think that you probably need to keep your plan at 4 times a day in some fashion right now, just based on how well you've been doing. I think going up to 6 times a day is going to create this sensation where you're chasing a feeling, okay? You're chasing the medicine. Instead of treating the pain, you're treating the impression that the pain medicine has left your body. And that is the beginning of problematic use, okay? So I would rather you take your medicine 4 times a day and decide between 5, 5.5, between 5 or 10 milligrams at each dose time. So like if you took it at 10 o'clock, you took your second dose and you took 10 milligrams, I'm hoping that, it powers you through, and maybe when you're getting to dinner time, maybe you only need 5 then, okay? And then at bedtime, maybe you need 10 to go through the evening. But I think you're asking for a little too much flexibility in the whole 3 to 6 times a day. All that's going to cause you to do is to always focus on, am I hurting? Am I hurting? Am I hurting? Am I hurt? Am I hurting? And remember that the whole point is you're supposed to be, am I functioning? Am I functioning? Am I functioning? Okay? So I'm worried that going up to that many, especially going from 5 milligrams to and doing 6 doses a day. I think if you just if you hit the pain a little harder every time that you hit it, or to have the option to hit it harder when you hit it and back off when you don't, I think you're going to probably end up in a better place. I think that was probably confusing, but the number one thing I don't think you need to be at this point is on 6 times a day dosing. I also don't think you necessarily need to be on extended release. I think that when you dose, it needs to be the right dose. That's all. And I hope that helps. I hope you and he or she have a very good conversations about this, because again, when you go, what about that? You need to be ready to ask the question. You can show them this video. What about the plan is not working? Okay? And you need to decide what success looks like before you worry about changing the dose anyway. You need to know how you're going to say, oh, okay, well now it's working. What's that going to look like? What increase in function is that extra medicine going to garner you? Okay? And then make sure that if you make a change in any sort, make sure you give them the opportunity to document how successful that change was, so that, because we're always having to do it, whether we say it out loud or not, we are always charting defensively to show that we are prescribing the appropriate amount of medicine for the goal of the plan. And so therefore, specific feedback about what you want the medicine to do, and then specific feedback that, oh my goodness, it's actually doing that, are both essential for their chart. So do that. I love y'all, no buts.